Okay, so good morning to all of you once again. Focusing on the INI-CET with MCQs and image based questions. Okay, so today and tomorrow we'll take this lecture, MCQs and image based. Right, students, I'm Dr. Pradeep Pawar, Professor of Anatomy, and I've got a vast experience of teaching the MBBS undergraduates as well as postgraduate students and the various entrance examinations, India and abroad. I've done my MBBS and MS in Anatomy. Okay, we start with the first MCQ, students. Come on, good morning, good morning, good morning to all of you. So be interactive, understand and answer. Have a look at this. Answer this MCQ. Read the MCQ and answer it. Chalo, students, start. Answer, just tell me the option. Whatever you feel you answer, that's okay. We will discuss this. Okay, I'll start. Have a look. A 50 years old male comes to the clinic. Okay, one moment, I'll just use the highlighter for you. So 50 years old male comes to the clinic with loss of taste sensations. Okay, loss of taste sensations. So when this comes to your mind, loss of taste sensations, tell me, students, taste sensations, how do we define it? Anterior 2/3 of the tongue, posterior 1/3 of the tongue, and the posterior most part of the tongue. That's how we divide the tongue, right? Anterior 2/3 of the tongue, general sensations are by whom? General sensations, yes, lingual nerve. Anterior 2/3, general sensations, lingual nerve. The special sensations, tell me, students, answer, keep on answering, be interactive. Anterior 2/3, special sensations are supplied by whom? Are carried by whom? The chorda tympani branch of facial. Right, so anterior 2/3 of the tongue, general sensations is a lingual nerve and special sensations is the chorda tympani nerve, chorda tympani branch of facial nerve. Okay. Option is D. Right, correct. Yes. Posterior 1/3, both general as well as special sensation is by whom? Glossopharyngeal nerve. And the posterior most part of the tongue, that's the vagus. To be specific, which branch of vagus is it? The internal laryngeal nerve. It's a branch of vagus. Superior laryngeal and the branch of superior laryngeal, internal laryngeal. I'll just finish this. Tell me, anterior 2/3 of the tongue, students, anterior 2/3 of the tongue is derived from which pharyngeal arch? Anterior 2/3 of the tongue is derived from the first pharyngeal arch. The nerve, the first arch, is lingual, and that is how anterior 2/3 is supplied by a branch of mandibular nerve. Nerve, the first arch is mandibular, so it's supplied by a branch of mandibular, that's lingual. Posterior 1/3 of the tongue is derived in the third arch. It is derived from the cranial part of Hypobranchial Eminence. Cranial part of Hypobranchial Eminence. It's in the third arch. So the nerve supply is glossopharyngeal. And the posterior most part of the tongue is derived in the fourth arch from the caudal part of Hypobranchial Eminence. Caudal part of Hypobranchial Eminence, it is also known as cupula. So which is the nerve, the fourth arch? Superior laryngeal nerve, superior laryngeal, and the posterior 1/3 is supplied by a branch of superior laryngeal, that's the internal laryngeal nerve. Internal laryngeal. I'll quickly draw this for you and tell you. So whatever comes in the way, I'll try to explain you. Tell me, what is this? What is this from outside? What do you call this from outside? These are the ectodermal clefts, and clefts. And what are these? These are the endodermal pouches and pouches. Same here, endodermal pouches here, pouches. And what are these? Ectodermal clefts. So what is this view? This is a section, right? This is the section taken from the neck. Section taken from the neck. What is this section? A coronal section. That's a coronal section from the neck. From outside, this is going to be ectoderm. Ectoderm from outside. From inside, that's a GIT. So from inside, this is going to be the endoderm. We call this as endodermal pouches, and this is the ectodermal clefts. Fine. And in between is the mesoderm. बीच में mesoderm होता है. So now we join this like this. We join one side to the other side. This becomes one pharyngeal arch, second pharyngeal arch, third pharyngeal arch, fourth pharyngeal arch, and then we have got the sixth pharyngeal arch. So these are the pharyngeal arches. I just want you to understand each pharyngeal arch, students. These are very important topics. You should know this. Each pharyngeal arch from outside is lined by what? Ectoderm. From inside it would be lined by endoderm, and beach mein hoga mesoderm. In between would be the mesoderm, correct? Now students, in the first arch we get two prominences here. What is this known as? The lingual swellings, and a prominence behind, we call this as the tuberculum impar. Two lingual swellings and tuberculum impar forms the anterior 2/3 of the tongue. Clear? Anterior 2/3. First arch hai. So which is the nerve of the first arch? Mandibular nerve. So anterior 2/3 is supplied by a branch of mandibular. What's that? Lingual nerve. Lingual. Right? In the third and the fourth arch, we get a prominence here. What is this prominence known as? Hypobranchial eminence. It is also known as the cupula. Hypobranchial eminence or the cupula. It divides into a cranial part and a caudal part. Now, the cranial part of hypobranchial eminence forms what? The cranial part of hypobranchial eminence forms the posterior 1/3 of the tongue. Posterior 1/3, which is a nerve here, glossopharyngeal. So, posterior 1/3 is supplied by glossopharyngeal nerve. And the last part, the posterior most part, what is this now? This is the caudal part of hypobranchial eminence that forms the posterior most part of the tongue, and it also forms the epiglottis. Posterior most part of the tongue and the epiglottis is derived from the fourth arch. The nerve is superior laryngeal. It's a branch of superior laryngeal, and that is the internal laryngeal nerve. Internal laryngeal. So this is going to form the structure of the tongue. The muscles of the tongue are derived from occipital myotomes. Occipital myotomes. So muscles are derived from occipital myotomes. Fine. So I just quickly told you the tongue. A 50 years old male comes to the clinic. Answer now. A 50 years old male comes to the clinic with loss of taste sensations. On examination, sensations were not felt on the posterior 1/3 of the tongue. Students, posterior 1/3 of the tongue. Which is the nerve there? Glossopharyngeal nerve. Lesion of glossopharyngeal nerve was suspected. One of the following statements about this nerve is false. Okay. So come on, quickly we'll revise the glossopharyngeal nerve. Whatever you know about this nerve, just tell me. So you'll get an overall orientation for all the nerves, right? Tell me students quickly, glossopharyngeal nerve is a nerve of which pharyngeal arch? Come on, answer. Glossopharyngeal nerve is a nerve of which pharyngeal arch? Third, there's one muscle in the third arch. There's only one muscle present in the third arch. Name? Stylopharyngeus. Stylopharyngeus. So glossopharyngeal nerve supplies the stylopharyngeus muscle. Glossopharyngeal nerve supplies the stylopharyngeus. To supply the muscle of the pharyngeal arch, what component should the glossopharyngeal nerve have in its nucleus? समझ में आ रही है? Glossopharyngeal nerve supplies the stylopharyngeus muscle, which is derived from the third pharyngeal arch. अब, to supply the muscles of the pharyngeal arches, what component should the glossopharyngeal nerve have in its nucleus? So the first component is the special visceral efferent component. Special visceral efferent. And what is the special visceral efferent component supply? It supplies the muscles of the pharyngeal arches. Okay, so that's the special visceral efferent component. Will supply what? Will supply the stylopharyngeus muscle. Stylopharyngeus muscle. And what is the name of the nucleus of the glossopharyngeal nerve to supply the stylopharyngeus muscle? Anyone? Answer this. What is the name of the nucleus of the glossopharyngeal nerve to supply the stylopharyngeus? Anyone? Chalo, bolo, be interactive. So glossopharyngeal nerve supplies the stylopharyngeus derived from the third pharyngeal arch. To supply the muscles of the arches, what component should the nerve have? The component is special visceral efferent. And what is the name of the nucleus of this? Sorry, this is gone again. What is the name of the nucleus? Okay, so this is special visceral efferent supplies the stylopharyngeus muscle, stylopharyngeus, and the name of the nucleus is nucleus ambiguous. Nucleus ambiguous. Fine. What else is the glossopharyngeal nerve supply? Very good, very good. Nucleus ambiguous. Very good. What else is the glossopharyngeal nerve supply? It supplies the parotid gland, right? Supplies the parotid gland. To supply the glands, students, to supply the glands, what component should the nerve have in its nucleus? The name of the component is general visceral efferent. Okay, general visceral efferent component. And what does this component supply for the glossopharyngeal nerve? It supplies the parotid gland. Can anyone tell me the name of the nucleus of the glossopharyngeal nerve which is going to supply the parotid gland, which belongs to this general visceral efferent component? Follow, students. The name of the nucleus of the glossopharyngeal nerve. Answer. I'm looking at the screen. Answer. You should be able to understand all the nerves like this, and all the functional components. Then only you'll understand this topic. Okay, so the glossopharyngeal nerve supplies the parotid gland. To supply the parotid gland, वो कौन सा component होगा? General visceral efferent component. And name of the nucleus? No, it's not this. No. FTF. What's your name? It doesn't serve. No, this is not the nucleus. The nucleus is inferior salivatory nucleus. Inferior salivatory nucleus. Very good. So the name of the nucleus is inferior salivatory nucleus. Very good. Excellent. What else is the glossopharyngeal nerve supply? If you know what the nerve supplies, you get the components, and वो components के nucleus होता है. Just try to understand it like that. So what else is the glossopharyngeal nerve supply? The tongue, it supplies the tongue, which posterior 1/3 of the tongue, right? Posterior 1/3 of the tongue. Special sensations. To supply the tongue, what component is required? It's the special visceral afferent. Special visceral afferent component supplies the posterior 1/3 of the tongue, and इसका nucleus है nucleus of tractus solitarius. Nucleus of tractus solitarius. Very good. And what else is the glossopharyngeal nerve supply? It also supplies the posterior wall of the pharynx. Posterior wall of the pharynx it supplies. Okay. So what is the name of the component? That's the general visceral afferent. It supplies the posterior wall of the pharynx, and it gives to the spinal nucleus of the trigeminal nerve. Spinal nucleus of trigeminal nerve. So this becomes the nucleus of the glossopharyngeal nerve. So what are the nucleus? One is nucleus ambiguous, the inferior salivatory nucleus, the nucleus of tractus solitarius, and the spinal nucleus of trigeminal nerve. It carries sensation, the glossopharyngeal nerve carries sensation from the posterior wall of the pharynx, and finally it gives it to the spinal nucleus of trigeminal nerve. Fine. Now these are the nucleus. Tell me, now fibers will arise from all this nucleus, and the fibers of the glossopharyngeal nerve are where? Where are they attached to? I'll come to the slide. Come on students, bolo, my dear children, bolo. Where are the fibers of glossopharyngeal nerve attached to? Just look at the slide. What is this, you tell me? What is this? This is the midbrain. That's the pons here. That's the pons, and that's the medulla. Correct? Who's this in the medulla? The first elevation here. That's the pyramid. Very good. What is this elevation? Olives. And what is this third elevation? ये है inferior cerebellar peduncle. Inferior cerebellar peduncle. So that's the pyramids, that's the olives, and that's the inferior cerebellar peduncle. Now, where is the attachment of the glossopharyngeal nerve to the brainstem? The glossopharyngeal nerve is attached here between the olives and the inferior cerebellar peduncle. Between the olives and the inferior cerebellar peduncle, there are three nerves: 9th, 10th and 11th. Cranial accessory. The 9th nerve, the 10th nerve and the cranial accessory. They are present between the olives and the inferior cerebellar peduncle. Right, they are present between the olives and the inferior cerebellar peduncle. The 9th nerve is the most cranial, next is the 10th, and next is the cranial accessory. And between the pyramids and the olives, who's attached? 12th nerve. Between the pyramids and olives is 12th nerve. Fine students? So that's the glossopharyngeal nerve attached to the brainstem. Between the olives and the inferior cerebellar peduncle, it's below the, it's above the 10th nerve. Above the 10th nerve. Now this glossopharyngeal nerve will get out through which foramen? Anyone? Chalo, answer this. Answers. Come on, students. Glossopharyngeal nerve will get out through which foramen of the skull? Yes, that's the jugular foramen. Jugular foramen. वैसे jugular foramen के 3 compartments होते हैं, anterior, middle and posterior. The glossopharyngeal nerve gets out through which compartment? Middle compartment. Middle compartment से जाता है 9th, 10th and the cranial and the accessory nerve. 9th, 10th, 11th nerves. So glossopharyngeal nerve gets out through the jugular foramen. The moment it gets outside the skull, it is now outside the skull. Now it enters the pharynx. Right now the glossopharyngeal nerve enters the pharynx between. Yes, anyone? Can you answer this? How does the glossopharyngeal nerve enter the pharynx? It goes between the, what is this muscle, students? That's the superior constrictor. And what's this muscle? That's the middle constrictor. Between the superior and the middle constrictor muscles of the pharynx, the glossopharyngeal nerve is going to enter the pharynx along with the stylopharyngeus muscle. The stylopharyngeus muscle and the glossopharyngeal nerve, they go between the superior and the middle constrictor muscles of the pharynx. So that's about the glossopharyngeal nerve. Answer the MCQs now. Come on, chalo, answer now the MCQs. Supplies the stylopharyngeus muscle, correct? Yes, the glossopharyngeal nerve, yes, supplies the stylopharyngeus. Is attached to the brainstem above the vagus nerve, correct? It's 9th, 10th and 11th, so it's above the vagus nerve. Contains special visceral efferent fibers. Tell me, students, what is the special visceral efferent fiber supply? Special visceral efferent. The special visceral efferent fibers are going to supply the stylopharyngeus muscle. Stylopharyngeus. Special है, special बच्चे, general visceral नहीं है. It's general visceral efferent supplies the parotid. Special visceral efferent supplies the stylopharyngeus muscle. Emerges from the brainstem between the pyramids and the olives. That's wrong. It emerges from the brainstem between the olives and the inferior cerebellar peduncle. Between the olives and the inferior cerebellar peduncle. That's it. So answer is D for this. D. Clear to all of you? Any doubts? Students, any doubts? Ye clear hai na? Be perfect with all these nerves, huh? Be perfect with the functional component. This you should know. Be perfect with the nucleus of the cranial nerve. Which nucleus supplies what? That you have to know. Huh? Okay, very good, very good. So be clear about this and be clear about the functional components. Like I have given an orientation to the about the glossopharyngeal nerve. वैसे हर एक nerve का अपना component होगा. You just have to know what the nerve is going to supply. Bas, if you know what the nerve is going to supply, you know the component which the nerve should have, and that component will have its own nucleus. That's how you understand it. Okay, very good. Chalo, we'll come to the next MCQ. Very nice. Okay, have a look at this and just identify this 2 pointed structures. First you identify the blue pointed structure, blue, and then the black. First you identify the blue pointed structure. Anyone? Identify the blue pointed structure. Yes, Pragya. Clear hai na? Very good. Chalo. Identify the blue pointed structure. Anyone? Bolo. This is a vein. This is a vein. The blue pointed structure is a vein. Blue is the sagittal sinus. नहीं बच्चा, sagittal sinus नहीं है. No, sagittal sinus कहाँ पे होता है? एक मिनट. I'll just tell you this. Now that you've answered sagittal sinus, one moment. One moment. I'll quickly tell you this. Look, you tell me what is this fold of dura mater? ये ना ऐसे एक fold of dura mater होता है which is going to separate the two cerebral hemispheres. Anyone? This is the fold of dura mater which is going to separate the two cerebral hemispheres, and this is what we call as the falx cerebri. Falx cerebri. So this is falx cerebri. It's a fold of dura mater which is going to separate the two cerebral hemispheres, right? Falx cerebri. Cerebri. Okay. The upper border here, na, the upper border of falx cerebri goes up and splits like this. Yeah, na, the upper border of falx cerebri goes up and splits like this. Yeah, ऐसे split होता है, and this is attached to this suture. What is this suture here? This is the sagittal suture, and this sinus here is known as the superior sagittal sinus. ये sinus होगा superior sagittal sinus. Okay. So superior sagittal sinus is enclosed by the falx cerebri on its upper border. Perfect. Understanding? And now you tell me, what is this part of the brain here? ये क्या होता है? ऐसे. That's a corpus callosum, right? And the lower border of the falx cerebri is attached to corpus callosum. The lower border of the falx cerebri is attached to the corpus callosum. Here, students, here it encloses a sinus above the corpus callosum, and this is what we call as inferior sagittal sinus. This should be perfect. So superior sagittal sinus यहाँ होता है on the superior border of the falx cerebri. Inferior sagittal sinus is present at the lower border of the falx cerebri. And this inferior sagittal sinus, अब है ना यहाँ पे there's another fold of dura mater. If you can answer this, there's a fold of dura mater like this, हाँ, दोनों sides पे. I'll draw it like this for you. ऐसे ना एक fold of dura mater होता है. और if I have to show it like this for you, I'll draw it like this. ये देखो. See if you can understand this. I don't have the slide right now, but what is this fold of dura mater? बोल सकते हैं कोई? हाँ, very good, very nice. This is what we call as the tentorium cerebelli. Tentorium cerebelli. तो यहाँ पे होता है ये tentorium cerebelli, and the falx cerebri is sitting on the tentorium cerebelli. If I draw the falx cerebri here, the falx cerebri is lying on the tentorium cerebelli. Now this tentorium cerebelli is going to separate what from what? Who's below the tentorium cerebelli? The occipital lobes. Occipital lobes are below the tentorium, and who's above the tentorium? That's the एक मिनट. Who's below the tentorium cerebelli? That's the cerebellum. I'm so sorry. That's the cerebellum. And who's above the tentorium cerebelli? That's the occipital lobe of the cerebrum. Occipital lobe of the cerebrum. And in this tentorium cerebelli, you get a sinus here. Can anyone answer this? What is this sinus here in the tentorium cerebelli? एक sinus होती है. बोलो. The inferior sagittal sinus will continue as that sinus. Simple. If I give you a hint, you will be able to identify. But if you can answer this, sigmoid नहीं बचा. It's not sigmoid. It becomes straight. Look no. It is going straight. It is known as the straight sinus. Straight sinus, है ना? So this is what we call as the straight sinus. Straight sinus. Confluence is different. So tell me, students, now ये जो superior sagittal sinus है ना, ये superior sagittal sinus पीछे आ गया. It has come back side here. Look, I'll make this like this as the superior sagittal sinus for you. ये अपना superior sagittal sinus आ गया. Now this superior sagittal sinus goes to the right side like this. Right side. What do you call this as? इसे हम बोलते हैं right transverse sinus. Right transverse sinus. The right transverse sinus now becomes an S. क्या बोलते हो? This is what we call as the sigmoid sinus. And the sigmoid sinus now leaves the skull through the jugular foramen. अब ये क्या बनेगा? What is it now? The internal jugular vein. It now becomes the internal jugular vein. Okay. So superior sagittal sinus comes back. Goes on the right side, right transverse, right sigmoid, and the right internal jugular vein. I'll write that for you. Now coming to the inferior sagittal sinus. The inferior sagittal sinus runs at the lower border of the falx cerebri. Now runs in the tentorium cerebelli as straight sinus. Now goes to the left side. क्या बोलोगे इसको? That's the left transverse sinus. Now becomes an S, left sigmoid sinus, and now leaves the skull through the jugular foramen. It's the left internal jugular vein. Are you all following this? Is this clear? If it's not clear, you tell me. ये जो पीछे point and at this point, but the superior sagittal, the transverse sinus, and the inferior and the straight sinus meet. That point is known as the confluence of sinuses. Okay. I hope this is clear. Look, the superior sagittal sinus continues as what? I'll just use a pen, one moment. The superior sagittal sinus continues as the right transverse sinus. Right transverse sinus continues as the right sigmoid sinus, and then it becomes the right internal jugular vein. The inferior sagittal sinus inferior sagittal sinus first becomes the straight sinus. Right, it first becomes the straight sinus, then it becomes the left transverse sinus. Left transverse sinus, then it becomes the left sigmoid sinus, left sigmoid, and then it becomes the left internal jugular vein. Okay, fine, that's about the sinuses. Okay, so we just went to a different topic altogether, that's fine. Okay, coming back to our original topic, have a look. So this was our topic here. What is this blue pointed structure? Chalo, once again, the question is open to answer. What is this blue structure? It's a vein, it's a vein. Ek beta, if you can tell me, what is this section of the brain? That's a coronal section. And ye coronal section hai brain ka. You know, if you can tell me, students, what is this structure? Ye kaun hai? This nucleus is the caudate nucleus. Ye jo nucleus hai na, that is the caudate nucleus. That's the caudate nucleus. What is this nucleus here? This nucleus is the thalamus. Thalamus. So caudate nucleus, thalamus. Caudate nucleus and thalamus के बीच में एक vein होती है. There's a vein between the caudate nucleus and the thalamus. Name of the vein. Thalamostriate vein. This is what we call as the thalamostriate vein. Thalamostriate. Just remember this. This is the thalamostriate vein. It's between the caudate nucleus and the thalamus. So ये nucleus है caudate nucleus and this nucleus is the thalamus. So that's the thalamostriate vein. What is this, students? This is the choroid plexus. Choroid plexus, and there's a vein which drains the choroid plexus, right? There's a vein which drains the choroid plexus. Name choroidal vein. Choroidal vein. And there's a vein. What is this structure? कोई बोल सकता है? ये क्या है? ये. What is this? What is this? That's the septum pellucidum. Septum pellucidum, and ये है fornix. The upper arrow is septum pellucidum. The lower arrow is the fornix. Fornix. And this vein is known as the septal vein. Septal vein. Septal vein drains the septum pellucidum. बस ऐसे याद रखना. I'll write this for you. Understand this. This is slightly difficult and this is very important. Okay. So one is the thalamostriate vein. Thalamostriate vein. Thalamostriate vein. Second is choroidal vein. And third is septal vein. Okay, so thalamostriate vein lies between the thalamus and the caudate nucleus. The choroidal vein drains the choroid plexus. ये आप लिख लो. Choroidal vein drains the choroid plexus, and the septal vein drains what? Septum pellucidum. The septal vein is going to drain the septum pellucidum. This three will join to form the internal cerebral vein. Internal cerebral vein. Okay, so three veins joins to form the internal cerebral vein. And where does it form the internal cerebral vein? At the foramen of Monro. Foramen of Monro, you know, no? Interventricular foramen of Monro, which connects the lateral ventricle to the third ventricle, right? At the interventricular foramen of Monro, this internal cerebral vein is formed. And ये internal cerebral vein क्या होता है? It's a deep vein of the brain. ये deep vein है brain का. So internal cerebral vein, students, I want you to understand, it is formed by joining of three veins: the thalamostriate, the choroidal, and the septal vein. ठीक है? Thalamostriate, choroidal, and septal joins to form the internal cerebral veins. Two internal cerebral veins joins to form great cerebral vein. Great cerebral vein of, very good. Right, good. It joins to form the great cerebral vein of Galen, and this great cerebral vein of Galen drains into straight sinus. Yes, excellent. Very nice, bachcho. This great cerebral vein of Galen drains into the straight sinus. Right, where was the straight sinus lying? In the tentorium cerebelli. So that's a great cerebral vein of Galen. Clear hai, bachcho? This should be perfect, and this is very important. एक बार वापस slide दिखाता हूँ. I'll show you the slide once again. So I just want you to know this internal cerebral vein is a deep vein of the brain. Once again, just a quick go through. Internal cerebral vein is a deep vein of the brain formed at the foramen of Monro. ठीक है ना? तो दो internal cerebral veins होंगे which is formed at the foramen of Monro, and both this internal cerebral vein joins to form the great cerebral vein of Galen, and this great cerebral vein of Galen drains into what? Straight sinus. Fine. And how's this internal cerebral vein formed? It is formed by joining of three veins. One is the thalamostriate, second is the choroidal, and third is the septal vein. Thalamostriate, choroidal, and septal. That's it. Okay, fine. Have a look at this slide once again. Look at this slide. This is a very important slide. Have a look. Okay. So look, what is this vein now? The one in black is the internal cerebral vein. Internal cerebral vein. And two internal cerebral vein joins to form, what is this now? Great cerebral vein. That is the great cerebral vein. And what is this vein? This is the choroidal vein. This is the thalamostriate vein, and this is going to be the septal vein. Septal vein, thalamostriate vein, choroidal vein. Joins to form the internal cerebral vein. Two internal cerebral vein joins to form the great cerebral vein of Galen. Is this clear, students? कुछ डाउट है तो पूछो. If there's any doubt, you ask me. Should I proceed? Just put a thumbs up if you've understood. Chalo, then I'll proceed. Okay, fine. So we'll go to the next MCQ. Have a look at this and answer. I'll give 2 minutes to go through it. Okay. Answer this MCQ. B. Very good, very good, very good. Yes, Dr. Vanilla. Yes, very good. The rest of you, attempt. You should always attempt. Even if it's wrong, it's okay. Attempt karo. Fine. The answer is B. I'll start with this. Just have a look. Understand this MCQ. Yep. A 55 years old woman with a history of severe depression presents to the emergency with having cut deeply into the flexor surface of her wrist at the level of carpal tunnel. Okay, so that means the person has cut here at the level of carpal tunnel, deep cut. She has no sensations on the palmar or the dorsal aspect of the distal phalanx of her middle and index and half of her ring finger. So which of the following has been compromised? Yes, that the answer is median nerve. Answer is median nerve for this. I'll quickly go through this. Sorry. Okay, have a look. Understand this first. I'll draw this. That's the hand. I'm drawing the hand for you. Now what is this surface of the hand? This is the palmar aspect. And what is this aspect? That's a dorsal aspect. That's a dorsal aspect. These are the phalanges. Just give me 2 minutes. These are the phalanges. Okay, fine. I'll start. What is this, you tell me? That's the thenar eminence. That's the hypothenar eminence. मतलब एक है palmar aspect and एक है dorsal aspect. ये clear है? Palmar dorsal clear है? चलो students, very good. Now quickly tell me who supplies the skin over the palmar aspect of the thenar eminence. Who supplies the skin of the thenar eminence? Here. Answer this. Come on, students, be interactive. Answer. Who supplies the skin over the thenar eminence? Who's that? Who supplies the skin over the thenar eminence? Bolo. This is the palmar cutaneous. Oh my god. This is gone. I'm so sorry. Who supplies the skin over the thenar eminence? एक minute, I'll quickly draw this. If you know you answer till that time, I'll quickly draw this for you. Now this is gone. Median nerve, very good. Be specific, bacha, be specific. Which branch of median nerve is this? Which branch of median nerve supplies the skin? It's not median nerve, it's a branch of median nerve. Quickly tell me, which branch of median nerve is this? Okay, just give me 2 minutes. This, yeah, ye chana jayega, so I don't get this slide again. Okay, that's the thenar eminence, that's the hypothenar eminence. Students, what I'm telling you is, who supplies the skin over the thenar eminence? Yes, it is the palmar cutaneous branch of median nerve. Palmar cutaneous branch of median nerve. Very good, very good. And students, if you can tell me, where is this branch given? Where is this branch given by the median nerve? Palmar cutaneous branch of median nerve is given where? How does the median nerve enter the hand? How does the median nerve go to the hand? Through the carpal tunnel, right? The median nerve enters the hand through the carpal tunnel. But before the median nerve enters the carpal tunnel, when the median nerve is in the forearm, it gives a branch here. And this branch goes above the flexor retinaculum and supplies the skin here. So what is that? That's the palmar cutaneous branch of median nerve. And this palmar cutaneous branch of median nerve is given by the median nerve in the forearm before the flexor retinaculum. Ye clear hai? That means if the median nerve is compressed in the carpal tunnel, look students, this is extremely important. If the median nerve is compressed in the carpal tunnel, what are median nerve supplies in the hand? Everything is lost. But ये जो sensations है, these sensations are going to be intact. Why? Because this nerve goes above the flexor retinaculum and supplies the skin here. ये sensations intact हो गए. Are you following? And this is how we know that the median nerve is compressed in carpal tunnel. अगर median nerve यहाँ पे injury होता है forearm में, if the median nerve is injured in the forearm, the whatever median nerve supplies in the hand is lost. Plus there will be a loss of sensation of the skin over the thenar eminence also. That means we know that the median nerve is injured somewhere in the forearm or in the arm or in the axilla. This should be clear. Huh? Plenty of MCQs are, बहुत MCQs है ये topic पे, so be very clear about your concepts. Okay, right, I got this now. Palmar cutaneous branch of median nerve, and who supplies the skin here? That's the palmar cutaneous branch of ulnar nerve. Palmar cutaneous branch of ulnar nerve, and this palmar cutaneous branch of ulnar nerve is also given in forearm. ये दोनों nerves है ना, they go above the flexor retinaculum. The palmar cutaneous branch of median nerve, the palmar cutaneous branch of ulnar nerve. Both of them, they go above the flexor retinaculum. Very good. Now students, tell me, who supplies the skin here? Who supplies the skin on the palmar aspect of 3.5 fingers? Palmar aspect of 3.5 fingers. ये कौन supply करेगा? This is supplied by median nerve. Median nerve. So this is palmar aspect. Palmar aspect of 1, 2, 3.5 fingers. 3.5 fingers is supplied by whom? Median nerve. Of the same median nerve, students, the same median nerve goes to the dorsal aspect. The same median nerve goes to the dorsal aspect. Again supplies, one moment, I'll just draw those phalanges. The same median nerve goes to the dorsal aspect. Again supplies the distal phalanx of the thumb, the distal and the middle phalanx, distal and middle phalanx, and distal and middle half. This is supplied by median nerve on the dorsal aspect. So what is the median nerve supply? The median nerve supplies complete 3.5 fingers, complete 3.5 fingers on the palmar aspect. The same median nerve goes to the dorsal aspect. Students, supplies again supplies 3.5 fingers, but not all the phalanges. It supplies 3.5 fingers except proximal phalanges. Except the proximal phalanges. ठीक है? Now who's going to supply this 1.5 fingers? Look, this 1.5 fingers is left. No, this 1.5 fingers on the palmar aspect is supplied by whom? This is supplied by the superficial branch of ulnar nerve. Superficial branch of ulnar nerve. So the superficial branch of ulnar nerve supplies the palmar aspect of 1.5 fingers. The same superficial branch goes to the dorsal aspect. again supplies 1.5 fingers except the proximal phalanges. Easy है, same है वो, same है. Are you following this, students? Yes, are you following this? So now what is left for us? Only proximal phalanges and the dorsum is left. Proximal phalanges and the dorsum is left. Clear? So 3.5 fingers here, medial nerve. 1.5 fingers here, superficial branch of ulnar nerve. Dorsal aspect, 3.5 fingers except the proximal phalanx, medial nerve. 1.5 fingers except the proximal phalanx, superficial branch of ulnar nerve. Superficial branch of ulnar nerve. Now tell me, bachcho, who's going to supply this? One moment. Now, who's going to supply this proximal phalanges of 2.5 fingers? Proximal phalanges of 2.5 fingers. Proximal phalanges of 2.5 fingers and the dorsum. Proximal phalanges of 2.5 fingers and the dorsum is supplied by the superficial. Very good. Superficial branch of radial nerve. Radial nerve nahi hai bachche, it is superficial branch of radial nerve. Vanilla? Superficial branch of radial nerve. Because now we know the radial nerve divides into two branches. The radial nerve gives two branches. One is the superficial branch and the other one is the deep branch. And where does it give these two branches? In the cubital fossa. It gives these two branches in the cubital fossa. The deep branch is motor. What is that deep branch of radial nerve? Known as posterior intraosseous nerve. And it supplies the muscles. Now, whose sensory? The superficial branch. And the superficial branch of radial nerve, from the cubital fossa, how does it come here to the hand? It goes below this muscle. What is this muscle? Brachioradialis. It goes below the brachioradialis. It comes in the roof of anatomical snuff box and now it supplies the skin here. Okay, on the dorsum of the hand and the proximal phalanges of 2.5 fingers. Proximal phalanges of 2.5 fingers. Okay, students. And now what are we left with? We are left with proximal phalanges of 2.5 fingers. Proximal phalanges of 2.5 fingers and the dorsum. And this is supplied by the dorsal cutaneous branch of ulnar nerve. Dorsal cutaneous branch of ulnar nerve. 2.5. Proximal phalanges 2.5. Lateral 2.5. Superficial branch of radial nerve. Medial 2.5. The dorsal cutaneous branch of ulnar nerve. Dorsal cutaneous branch of ulnar nerve. Is this clear, students? I'll quickly once again go through. If there's any doubt, you tell me. This should be perfect. बहुत MCQs हैं. In different permutations and combinations, you'll get the MCQs. Any medial nerve, any radial nerve, any ulnar nerve MCQs, the cutaneous distribution will also be, one of the options will be on the cutaneous distribution. So this has to be perfect. Okay, crystal clear. Very good, very good. So I need not explain. Just once again, quickly. Palmar aspect. The skin over the thenar eminence is supplied by the palmar cutaneous branch of medial nerve. Hypothenar eminence. The skin is supplied by the palmar cutaneous branch of ulnar nerve. 3.5 fingers here is the median nerve. 1.5 fingers here is the superficial branch of ulnar nerve. Dorsal aspect. 3.5 fingers except the proximal phalanges, medial nerve. 1.5 fingers except the proximal phalanges, superficial branch of ulnar nerve. 2.5 fingers on the dorsal aspect and the dorsum on the lateral side, superficial branch of radial nerve, and 2.5 and the dorsum on the medial side is the superficial branch of, it's the dorsal cutaneous branch of ulnar nerve, dorsal cutaneous branch of ulnar nerve. Okay, perfect. Chalo, good. Right, so answer is medial nerve. Now you know what is the radial nerve supply, you know what is the ulnar nerve supply also. Flexor carpi radialis. Flexor carpi radialis. Does it go through the carpal tunnel? क्या बोलते हो बच्चों? Does the tendon of flexor carpi radialis pass through the carpal tunnel? Yes or no? Tendon of flexor carpi radialis. Does it pass through the carpal tunnel? Yes or no? Flexor carpi radialis. Bolo, students, come on, answer. Does the tendon of flexor carpi radialis pass through the carpal tunnel? No. It doesn't pass through the carpal tunnel. It passes through the split of the flexor retinaculum. है ना? The flexor retinaculum on the lateral side, it splits like this, it divides like this, and through the split of the flexor retinaculum passes what? Flexor carpi radialis. Okay, no, it doesn't pass through the carpal tunnel. No, bacho, it doesn't pass. No confusions. एक मिनट, see, one, don't get confused. I'll draw that for you quickly. ये देखो, अरे sorry. Look. These are the carpal bones. I'll draw that, no problem to speak. These are the carpal bones. If this is medial and this is lateral, what is this now? Flexor retinaculum. The flexor retinaculum splits here, it divides here. Now between the flexor retinaculum and the carpal bones, what is this tunnel? Carpal tunnel. And now what are the structures which pass through the carpal tunnel? This is the what are the structures which pass below the flexor retinaculum, to be specific? This is the tendon of flexor carpi radialis. So when we talk about structures passing through the carpal tunnel, we do not include flexor carpi radialis, because it passes through the split of the flexor retinaculum. Carpal tunnel ये होता है. And what is this tendon of? Anyone? What is this tendon of? And what is this bursa here? And what are these tendons of? What are these tendons of? Anyone? एक मिनट. हाँ, अभी बोलो. So this much I've drawn for you. I'm not drawing the entire thing here. What is this tendon of? This is the tendon of flexor pollicis longus with, what is that bursa? Radial bursa. Very good, radial bursa. And these are the tendons of flexor digitorum superficialis and flexor digitorum profundus with ulnar bursa. Right? Flexor digitorum superficialis and profundus with ulnar bursa. And what is this now? That's the median nerve. So given an option whether the flexor carpi radialis passes through the carpal tunnel, you should say no. It doesn't go through the carpal tunnel, but it goes through the split of the flexor retinaculum. It passes through the flexor retinaculum. Any doubts? Any doubts? कोई डाउट है तो बोलो बच्चों. This should be perfect. Now students, before I proceed to the next MCQ, let me quickly brief you about our platform. Now that we are starting with many courses here, now we've got this plus subscription in which you've got access to both live and recorded classes, learning from the top educators, live tests and quizzes, study on the device of your choice, and access to over 25,000 plus questions. And now we are coming up with printed notes for our 12 months and plus subscription students. Okay, an iconic subscription where you've got the best of Unacademy and the pre-platter. Students, here we have got a NEET PG compact for you and scholarships of over 1 crore rupees to be distributed amongst the students. 45 questions to be answered in 60 minutes. Yes, the date is 10th of October, 11 a.m. Be there, enroll now. Okay, 10th of October, 11 a.m. 60 minutes, 45 MCQs to be solved. The NEET PG compact, specially for you. Raise a hand technique in which there's a small icon there in the app. If you press the icon, you can directly talk to the educator. And student, one more thing. Now, free grand test for INI-CET 2021. Free grand test. Test is on 17th of October. One test was conducted recently. The second test is on 17th of October, Sunday, 2 p.m. to 5 p.m. 200 questions. Let's crack it, students. Do not forget to give this exam. Remember the dates once again. 17th October, that's Sunday, 2 p.m. to 5 p.m. 200 MCQs, free grand test. Okay, remember this. Now, special class features, we have got interactive classes, we've got poll for the learners, raise a hand technique in which you can directly talk to the educator, never miss a class with proper notifications being given, lecture notes, and anytime, anywhere you can get your doubts solved and you can access the lectures. A highly effective and curated question bank has been prepared for you for some 25,000 plus curated MCQs with detailed explanatory answers. Now, these are our toppers who have scored very good marks in the recent NEET PG entrance exam. Okay, so congratulations to all the toppers once again. And we have already started with this new batches from 6th of October, the Focus FMG batch, the Target NEET PG 2022, Mission INI-CET 2021, and Clinical Case Discussion and Instruments batches. We have started from 6th of October, and that's a NEET PG subscription which you download. Okay, clear students? So just remember the dates of the exams. Here we are. Come on, answer. Coming to the next MCQ. What is this foramen which I have pointed for you? Bolo bachcho, what is this foramen? Plenty of things to be explained in this. What is this foramen and what is the structure passing through the marked foramen? Okay, spinosum. Very good. That's the foramen spinosum. Abhi answer karo. Structures passing. Tell me the option. Answer is foramen spinosum. Marked structure is foramen spinosum. Huh? Yes, that's the middle meningeal artery. Very good. Answer is C for this. That's the middle meningeal artery. So what passes to the foramen spinosum is the middle meningeal artery and the nervous spinosus. That's a meningeal branch of mandibular nerve. Meningeal branch, right? So what passes to the foramen spinosum is the middle meningeal artery and the meningeal branch of mandibular nerve, also known as nervous spinosus. What is this foramen? Anyone? Come on, students. What is that foramen? Bolo. What do you know? You answer. That's fine. Yes, very good. That's a foramen ovale, and you must be knowing this MALE structures which pass to the foramen ovale. M, mandibular nerve. A, accessory meningeal artery. L, lesser petrosal nerve. E, emissary vein. What is this foramen, students? This foramen. Bolo bachcho. What is that foramen? The first one which I pointed. That's the foramen rotentum. Yes. And what passes to the foramen rotentum is the maxillary nerve. Right? Maxillary nerve. And that's the foramen lacerum. And what passes to the foramen lacerum is the internal carotid artery. That's foramen lacerum. What is this here? That's the optic canal. What passes to the optic canal is the optic nerve and the ophthalmic artery. And this is what I was telling you, students. What is this structure? You tell me. What is this structure? ये मैं दिखा रहा था आपको. What is this structure? Answer now. Bolo. What have I drawn? Come on, students, come on. What is this that I have drawn for you? I just told you this, no? I just told you this. Anyone? Very good. That's the tentorium cerebelli. This is what I was trying to tell you. That's the tentorium cerebelli. This exact thing I had drawn previously. So where is the attachment of tentorium? Tentorium is a fold of dura mater. Students, tentorium है ना? It's a fold of dura mater which is separating. Who's lying on the tentorium? यहाँ पे कौन होता है? That's the occipital lobe of the cerebrum. And who's lying below the tentorium? That's the cerebellum. So what does the tentorium separate? The occipital lobe of the cerebrum from the cerebellum. And who lies in the tentorium cerebelli, that's the straight sinus. Okay, so that's the attachment of tentorium. Right, tell me students, what is this foramen? This foramen. This is the jugular foramen. This is the groove for transverse sinus. This is the groove for sigmoid sinus. That's a groove for sigmoid sinus. And this is the jugular foramen. Here is the internal acoustic meatus. This is the internal acoustic meatus. This is the jugular foramen. Okay. Anything else? Any other doubts? If you have, you tell me. What is this? What is this? That's the superior orbital fissure. That's the superior orbital fissure. That's it. और कुछ doubts हैं? This is the cribriform plate of ethmoid bone. What do you call this? This as, what is this plate which are marked as crossed? This is the orbital plate of frontal bone. That's the orbital plate of frontal bone. If you break this orbital plate of frontal bone, we are right inside the orbit. We are right inside the orbit. That's the orbital plate of frontal bone. Who lies here? What is this? What is this slope known as? ये जो slope आप देख रहे हो, this slope is known as clivus. And who's lying on this clivus, students? Any idea who's lying on this clivus? This is the midbrain here, midbrain. ये brainstem है, brainstem. Who lies on this clivus? That's the brainstem. This would be the midbrain, that would be the pons, and who gets out from here is the medulla. The brainstem lies on the clivus. If you can tell me one thing, now tell me students, the brainstem is lying on the clivus, right? And all the cranial nerves are attached to the brainstem. All the cranial nerves except the first and the second. All the cranial nerves are attached to the brainstem. Where is the brainstem lying? In the posterior cranial fossa. Clivus कहाँ पे है? Posterior cranial fossa में. So which are the nerves present in the posterior cranial fossa? The nerves present in the posterior cranial fossa, if you can answer this, 1 to 12, 3 to 12, 5 to 12, 7 to 12. Nerves present in the posterior cranial fossa. What is your answer? Nerves present in the posterior cranial fossa. 1 to 12, 3 to 12, 5 to 12, 7 to 12. Very good, very good. It's 3 to 12. समझ में आया बच्चों? 3 to 12. Why 3 to 12? Because all the nucleus of cranial nerves are inside the brain stem except 1 and 2. The first and the second nerve nucleus नहीं होते. The rest 3 to 12 nerve के nucleus, where are they? In the brain stem. So all the cranial nerves will emerge out from the brain stem. Where is the brain stem lying? In the posterior cranial fossa. So all the cranial nerves to begin with would be present in the posterior cranial fossa. Then they will go towards this foramen. Respective foramen they will go, and that becomes the course of the nerves. And then they will go to the respective foramens. That's how the cranial nerves are. I hope you are following this. Tell me, facial nerve enters into which foramen? Facial nerve enters into the internal acoustic meatus. Facial nerve enters the internal acoustic meatus along with the 8th nerve and the labyrinthine artery. The 8th nerve and the labyrinthine artery. Mandibular nerve enters through foramen ovale. It passes into the foramen ovale. And maxillary nerve is the foramen rotentum. Foramen rotentum. Okay. Any doubts, students? The session is open for doubts. Any doubts, if you have, you tell me. I've completed the session for today. Tomorrow again 9 o'clock we'll be having a similar session, MCQs and visuals. Okay. So I hope things are clear, and I hope this pattern is good to good to follow. Here, any suggestions if you have, you can always tell me. Any suggestions? Clear now? Followed everything? Superior orbital fissure. Okay, ये देखो, one moment, I'll tell you. Look, yeah, now what is this? This is the lesser wing of sphenoid, and the lesser wing of sphenoid, and just below the lesser wing of sphenoid, there's an elongated fissure like this. What is that fissure known as? That is known as the superior orbital fissure. Superior orbital fissure, and this superior orbital fissure is, yeah, look, the superior orbital fissure is something like this. And this superior orbital fissure is divided into 3 compartments by, what is this known as? This is known as the common tendinous ring, or the ring of Zinn. And this ring of Zinn gives origin to the extraocular muscles, the 4 recti. This ring gives origin to. So now the superior orbital fissure is divided into 3 compartments, lateral, intermediate and medial. Who passes to the lateral compartment? That's the lacrimal, frontal and trochlear nerves. Lacrimal, frontal, trochlear. And no space here, so I've written outside. Who passes to the intermediate compartment? The oculomotor nerve, the 2 rami of the oculomotor nerve, the nasociliary in between and the abducens nerve. Oculomotor nerve, nasociliary and the abducens. And here we have a vein here in the medial compartment, that's the inferior ophthalmic vein. वैसे यहाँ एक वेन होती है सुपीरियर ऑफ्थैल्मिक वेन. सुपीरियर ऑफ्थैल्मिक वेन, inferior ophthalmic vein. Clear? So that's about the superior orbital fissure. So just remember this. I hope this is clear to you. Fine. Thank you, thank you, thank you. Thank you to all of you for your patient listening. I hope things are clear. So meet you tomorrow, same time, 9 o'clock. Okay? Thank you. I'll stop here.